Everyone, I'm here to assess the patient from anterior thorax and to musculoskeletal system, the upper and lower extremities. Before the assessment, I'm gonna wash my hands first, so let's start. Hi ma'am, my name is Jamaica Boyles Ibali from the School of University of Cebu, Lapu-Lapu, Mandawi, your student Mars for today. I'm going to assess the anterior thorax from musculoskeletal upper and lower extremities. Ma'am, can I ask your full name?
Megan Boyles,
When is your birthday?
April 4, 2006,
Your age?
15.
The procedure that I'm doing is I'm going to touch your skin and explore some of your body. It's okay for you?
Okay.
Okay, I have some questions here. Ma'am, do you have chest pain?
No.
Do you have problems of breathing?
No.
Okay, now let's proceed to the assessing the patient anterior thorax. First, inspect for the breathing pattern. Then, inspect for the total angle and the angle in which the ribs into the spine. Okay, ma'am, it's okay to touch you.
Okay.
Next is to palpate using the fingers. Palpate the tenderness and sensation and start palpating your hand over the cubicle. And move your hand left to right. Move your hand systematically downward, toward and the middle line. And the level of the breast and outward base to include the lateral aspect. Repeat the sequence to palpate to the preferred. Now we proceed to palpate the anterior thorax for the respiratory extortion. Place tab or both to your hands. Put your hands under the lower thorax with the finger along laterally to the ribs and your thumb alone. The costal margin as the client take breath while you observe the movement of your hand. Okay, ma'am, it's okay to touch you.
Yes.
Now we begin to procasting the anterior thorax. Systematically begin above the clavicle and the supracubicular space. And proceed downward to the diaphragm. Okay, ma'am, can you lay down the bed? I will percuse on you the chest. The last part of assessing the anterior thorax, auscultate the anterior breath sound and the voice sound. First is auscultate the trachea, and then auscultate the anterior thorax. Now place the diaphragm in the stethoscope firmly in the chest hole. Then auscultate the plexus of the lung, slightly above the clavicle, to the base of the lung. Please sit down, ma'am. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Summarize the information during the working phase. This goes to the finding of the client. Ask the client for any question, and don't forget to thank the client for cooperation. Okay, ma'am, I'm going to read the finding. Your finding is good and normal. Thanks for the cooperation and have a nice day. Now I'm gonna practice assessing the musculoskeletal system. I'm going to assess the upper extremities. So first, to inspect the hands from region, color, and texture. It's okay to touch your hand, ma'am?
Yes.
So the patient's hands, there's no discoloration, no lesions, and feels warm. Second is to check the capillary. Refill the time by depressing the nail bed. So the nail of the patient is normal. So next is to evaluate the arm sensory function. You should follow the guidelines of having the patient skip place with her eyes closed, scatter stimuli, vary the piece, compare the distal and proximal areas. Then compare the both sides of the body and map the area. Okay, ma'am, close your eyes. Then say the words now if you feel this object.
Now. 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 Now.
So the patient having equal sensation with the both sides. Next is to assess the patient pain sensation. So if I touch this in your hand, tell me if sharp or dull. Okay?
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Okay, good. Next is to assess the patient temperature sensation using the test tube of warm and cold water. Since we don't have the test tube, so the purpose of having the test tube is to taste the patient. He or she can really identify the cold and warm. So now we're gonna proceed to the test position sensation. Can you please close your eyes, ma'am, and tell me up and down?
Up. Down. Up. Down. Up. Up. Down. Down.
Okay, so next is to taste the patient touch discrimination with the next 4 tests. Okay, so the first test is to assist the patient's stereognosis. Okay, ma'am, close your eyes and tell me what object is this.
Coin.
Okay, good. Then, second test of the patient. Okay, ma'am, close your eyes and then open your palm. And I write the number and tell me what the number is this. Okay?
Number 1.
Good.
Number 2.
Good. So let's proceed the third test, the 2-foot discrimination. So I use this to identify. Okay, ma'am, can you close your eyes? Then, if I put this in your fingertips, tell me the number 1 or 2. Okay?
1. 1. 2. 1.
So the fourth test or the last test is to assess the extension touch of the corresponding parts of the body at the same time so that the patient can identify the location. Okay, ma'am, if I touch right over there, tell me where I can locate it or will be located. So now we're gonna proceed the cerebral function of the arms to assess the rapid alternating movement. Okay, ma'am, can you put your knees in palm? Up and down, then gradually increase its speed. So the patient's movement is coordinated. Okay, ma'am, can you touch your thumb on your finger in the same hand? So the patient's rapid scale is quick and accurately. Next is to assess the point-to-point location using the finger-to-finger test. Okay, ma'am, can you touch my finger to your finger and to your nose? Okay, good. The patient movement is smooth and accurately. Okay, ma'am, can you please close your eyes and straighten your both arms? And then touch your nose, one index finger. Then gradually increase your speed, okay? The patient's movement is smooth and accurate. So now we're gonna proceed assessing the patient in lower extremities. First is to inspect the legs, range in motion, muscle mass, and strength of the patient. Next is to assess the vascular system. Okay, ma'am, I'm going to inspect the color, hair condition, so the color of leg is brown. The third procedure is to palpate the back of the hand and check its temperature from the feet upward. Patient temperature of the leg is symmetrical from the left and to the fourth procedure is to flex the patient knee and compress the calf muscles against the tibia. Release the pressure and dorsiflex. Next is to palpate the femoral artery of the patient using the fingertips. Next is to locate the popliteal pulse, bend the patient. Knee and feel for the pulse for the popliteal fossa. The next procedure is to palpate the posterior cervical pulse and assess dorsal pubis pulse. Next, assess the edema by pressing over the tibia or medium malleus for 5 seconds. So now we're gonna proceed to assessing the patient leg by evaluating their sensory function. Assess the patient leg for light touch, pain, temperature, sensation. Like support the lower leg in one hand dorsal, reflex foot with the other hand. Next is to assess the cerebral function for the heel to chain test. Okay, ma'am, can you place your heel from the opposite knee and slide it down to the ankle? And do it again in the other side. Okay, good. So the patient movement of the leg is straight and normal. Next, okay ma'am, can you stand up and walk for 10 to 15 feet? Turn and then walk back. So the patient movement is symmetrical and smooth, and the arm is swinging freely and then can turn without losing her balance. Next is to perform the rubber test. Okay ma'am, can you stand your feet together? Then close your eyes. Then I observe 20 seconds to observe your balance, loose or not. So the patient has no abnormalities. The last procedure is to assess the patient tandem walking. Will you walk the song in the straight line, ma'am? So the patient can walk without losing her balance. And that would be all. Thank you.